Soluble fiber is a type of non-digestible carbohydrate that dissolves in water and gastrointestinal fluids to form a viscous gel-like matrix in the digestive tract. While insoluble fiber acts primarily as a bulk to promote laxation, soluble fiber actively interacts with metabolism. It is one of the most highly leveraged evidence-based dietary intervention for managing cardiovascular and metabolic risk. Here is a breakdown of its core physiological mechanisms and why it is clinically important. Cardiovascular and metabolic importance. 1. Lipid lowering via bile acid sequestration. This is arguably its most crucial role in cardiovascular health. The gel formed by soluble fiber binds to bile acids in the small intestine, preventing their reabsorption via the enterohepatic circulation and promoting their excretion in feces. To replace these lost bile acids, the liver must upregulate the expression of LDL receptors, actively pulling LDL cholesterol out of systemic circulation. In essence, it acts as a natural mild bile acid sequestrant. 2. Postprandial glycemic control. By increasing the viscosity of chyme, soluble fiber delays gastric emptying and slows down the enzymatic digestion and absorption of carbohydrates. This significantly blunts postprandial glucose spikes and reduces the corresponding insulin surge. Over time, this mechanism improves overall insulin sensitivity, making it a cornerstone intervention for metabolic syndrome and type 2 diabetes. Short-chain fatty acid production and endothelial health. When soluble fiber reaches the colon, it is fermented by the gut microbiota. This fermentation produces short-chain fatty acids, primarily butyrate, propionate, and acetate. Short-chain fatty acids are vital for colonic mucosal health, but they also exert systemic effects. They help modulate the immune response, reduce low-grade systemic inflammation, which is highly protective of endothelial function, and propionate specifically has been shown to inhibit hepatic cholesterol synthesis. Key sources and fiber types. When structuring dietary advice, it helps to break down soluble fiber into its specific types as they offer slightly different mechanisms of action. Beta-glucans, highly effective at LDL reduction, carries a specific FDA-approved health claim. Top food sources: oats, oat bran, barley. Pectin, excellent for slowing glucose absorption and delaying gastric emptying. Top food sources: apples, citrus fruits, berries, carrots. Psyllium forms a highly viscous gel, excellent dual action for both lipid lowering and bowel regulation. Top food sources: psyllium husk supplements. Gums and mucilages, strong overall metabolic benefits and short chain fatty acid production. Top food sources: legumes, beans, lentils, guar gum. Most major guidelines suggest targeting 10 to 25 grams of soluble fiber daily out of a total 25 to 30 gram fiber goal to see clinically significant reductions in LDL cholesterol and meaningful improvements in glycemic control.